So thank you all for joining us. We're right about 7 o'clock, so we will get started. So this is the next in our series of webinars that we'll be offering in the Prairie region. What we wanted to do is change it up a little bit. So the first couple of webinars, if you were able to attend, we talked a little bit about the legislation, tips for locals and components and representatives, health and safety committee members. What we want to do a little bit this evening is change it up a little bit, a couple different ways. So this evening, we're going to look at mental health strategies for mental health well-being for members in the workplace, for individuals. So not so focused on the legislation. And the other key part that we'll be doing is we're having a sub-IELTS talk tonight. I'll do my introductions, and this might be the last you hear of me. So we're going to change it up a little bit. Hopefully you gain a lot of experience. We ran through this webinar this afternoon with the staff. It was a fabulous experience with great feedback that Gina was able to take some of those feedback suggestions back and even add into this webinar that we're doing this evening. So with that, I will turn the microphone over to Marianne for a couple opening comments.
Hi, everyone. Thank you so much for joining us again. One of the things that I've always enjoyed is, being a union leader is going out and talking to members. And so I think that's been one of the most difficult things that I've had is not being able to have those face-to-face conversations. I also want to say many thanks to Clint, who's organized these webinars. We're focusing on health and safety, and now the idea is to make it a little bit more personal and give you some tools, not only as a union activist, as a local executive member, but also for you personally. So this is something that I think, we will be expanding on this a little bit more in the coming weeks. We don't know how long this scenario is going to take. And everyone is in a really unique situation just with whether you're working from home, whether you're still working in the workplace, all the additional stressors that you're dealing with and that your members are dealing with. And so this was an idea to give you a little bit of information on resources and some assistance. So I'm going to let Gina do her thing. She has been a great friend of PSAC since she started with the Winnipeg United Way, and I thank her for making herself available. And I will also say, after this webinar, if you need more information, you have topics, you have suggestions, by all means, put them in the chat box in the question for future. It's something that we can always look at. So I won't take up any more time, but I will be on the line. So if there's questions that I can help out with later, I most definitely will do that. So thanks so much.
So thanks, Marianne. Because we have such a large group, one of the suggestions that Marianne made was very relevant. So part of the webinar that we use, we're able to actually record the questions. So even if we aren't able to address your question through this webinar, what we will do is record that question and have somebody respond to you at a later date, whether that's somebody from the regional office, from the REVP office, Marianne's office, or from your local or a component. We'll pass that on depending on the information provided. One question I did notice that I'll quickly cover. This webinar will be recorded and shared on the PSAC Prairie's website and distributed that way. The two previous webinars have been recorded, so the actual visual webinar along with the slide presentations are both available online at PSAC Prairie, or what is it? Marianne, help me out here.
Prairies.psac.com.
Yeah, nationals, PSAC, union.ca. Yeah, thank you.
Yeah.
So all of the previous webinars are available there. So with that, I will turn the microphone over to Anil to introduce our guest speaker.
Thank you, Clint. Good evening, everyone. Welcome to Union Strategies for Mental Health and Wellbeing. I have the great pleasure to introduce our presenter for this evening. Gina McKay is an executive member of CUPE Local 2348, the lead facilitator at Tamarack Consultation and Training Services, and the labor director at United Way Winnipeg on Treaty 1 in Manitoba. Throughout the last 17 years, Gina has dedicated her career to working in the community health and social services sector, working with the advancement of education and training services in the areas of community and social health, sexuality, diversity, equity, inclusivity, community engagement, and mobilization. She's a queer, Métis, feminist, labor movement activist and facilitator, and is engaged in the regional, national, and international labor movement, holding numerous positions on human rights, 2SLGBTQ+, Pink Triangle, and Solidarity and Pride committees. Welcome, Gina.
Great, thank you so much. And thanks for having me and for the introduction and for joining in today's webinar. So we're going to be discussing union strategies for mental health and well-being. Before we get started, I'd just like to respectfully acknowledge that I'm facilitating today from Treaty 1 territory. So this is the home of the Cree, Oji-Cree, Dene, Dakota, Ojibwe, and the homeland of the Métis Nation. I'd like to thank the First Peoples of Treaty 3 as well, whose water provides Treaty 1 with nourishment, and the First Peoples of Treaty 5, whose rivers power our webinar today. So thank you for that and for joining us today. And I know that we've got members coming in from all three prairie provinces. So thanks for being here. So I'll tell you a little bit about the module that we're going to do today, and then we'll move right through. One thing that Clint did mention is down the side, you've got the handouts. There's a number of different handouts, and then you'll actually have the PowerPoint presentation as well to follow along. So if you are wanting to spend a bit more time on one of the graphs or one of the images that I've included, that you have that listed in one of the top 4 resources here called Union Strategies for Mental Health, and you can follow along in that way as well. And I did mention too earlier today that if you have any questions after, we keep the communication open. We're here to help build understanding and awareness, build connections and resilience, and essentially is to build a stronger community. We're all working through a difficult time right now, and so the intent here is to have great conversation, share some information, and build some connection points for yourselves and for the membership. And so today I'll tell you a little bit about the module, and then we'll jump right in. The intent of the module is to explore all the ways that we can work together as labor leaders, as staff, and as support teams, and in the building of stronger communities for our teams and members. We can explore the actions that we can take, the resources that are available in each one of our provincial communities, and to help us support, and really that's the key, is to help us support workers during the COVID-19 pandemic. And so we will make reference to sort of some really pertinent information. And then really it's about building a foundation for a stronger prairie region, and it's built on solidarity and strength. And so that all in all is us coming together to share information. I think the impact of the pandemic has instilled uncertainty, absolutely. It's instilled fear, confusion, and a surge of stress-related responses as more and more time passes. This is a first for everyone. So on the heels of some of our strike action and long, difficult relationships with expiring collective agreements, employers, we find ourselves looking to the foundations of our labor movement to keep our members supported and connected, valued, and prioritized. So with some of that work comes impact to our own teams as well. And so I hope to explore some of these strategies to build on them for others. And so here, I hope that you get as much as you can out of the session, and feel free to put those questions in. I'm happy to create the conversation at the end. And I always say we're as strong as our most silenced member. And so building solidarity and strength during this time is key. And during a crisis, it's key. So not only can we build a more solid ground, and we can take advantage of that time to connect in different ways, but it's also a way for us to coordinate with and build a stronger community for our membership. And so this becomes essentially a way that we can help mentor some of the strategies, not only for ourselves and our components, but also for the membership. And so I think no matter what, when we can understand those concepts and work together, then we can really make a difference for the members. So I'm looking forward to getting going here with you. And here's just some of the objectives. So the objectives here are talking about some intro concepts just around mental health and well-being, some of the impacts, stigma, which is really important to talk about, and then also some of the realities. And I use the word realities in a way because a lot of times people talk about mental health as issues or problems. You hear this type of language. And so I'll be using the realities because they are realities of living with mental health. And then we'll look at some of the strategies for well-being and some of the things that we can do together and on our own. And I think no matter what, we can build this into some of the concepts for building stronger locals and components. So that really the intent is to explore all these ways that we can work together and ways that we can help mimic that and mentor it into our communities and in with our teams. And really with the goal in mind is supporting those members during the pandemic and to build the foundation. With the heightened, I would say a heightened time where there's new information coming every day, the impacts change. And so one of the ways that we'll look at that is the impacts of mental health. So I look forward to doing that with you. So let's get started right here. Let's start with what are the impacts of mental health? So just as we are unique individuals, so are the ways that we'll respond to our environments. Each one of us is different. All of our members, our staff, our leadership are all experiencing the impacts of the COVID pandemic. And what we all have in common, although individual, is unknown results, uncertainty for what tomorrow will bring. And this compounded with some of the stresses of our own individual experiences, so what we're experiencing on our own, it can result in a spike of pressures, stresses, and I would say acute uncertainty. Every time you turn on your computer or you check your social media, or if you have the TV going, there's new information and changes happening all the time. And so on our own, we may be practicing self-care. That might be a part of your practice. You might have your own grounding strategies in your daily life, but also as the weeks wear on, because we're at a month at this point, 4 weeks in, the fear of pay continuance, potential layoff is pending for many of us. It's uncertainty. We find ourselves having a harder time working through some of those daily tasks, changing workloads, not knowing if and when we're in the workplace, if we're working remotely, are we getting enough done? All of those things come up. And so whether or not you're an essential worker or you're working remotely, to adhere to some of the isolation and the physical distancing measures, it can be harder to work through and deal with some of our own compounding mental health and well-being practices. So even if we do practice those pieces on our own, it can be hard to fit that into a day when you've got a lot on your mind. So today's goal is to build some of the capacity amongst our team. And so I'm happy to see so many of you here with us. And we can also help model this healthier behavior, more supportive coping strategies and practical supports. And then we'll actually explore some ways, like what is a social support system and how do we build it? And if we feel like we have one, how do we build on it as time changes? So once we can model some of this behavior, we can help build stronger advocates and communities amongst the membership. So it's like, you know, here's me in my dining room working remotely, also sharing this with so many of you, and then each one of us can become an advocate to help start conversations and model the behavior. And how we're going to do that is exactly what we're going to talk about here today. So to understand mental health and well-being, we need to explore some basic understanding. So the World Health Organization defines mental health as such, a state of well-being in which we realize our potential, can cope with the normal stresses of life, can work productive and fruitfully, and able to make contributions to our community. So you might ask, what is normal? They use the word normal. So we all have our own baseline for where we feel most at balance. So this might be, quote unquote, your own normal. I don't like using the word as a normal because each one of us are so unique and we're very different. And so I like to look at it as a way of where do I feel most at balance? What do I need? And it might be different from each one of us, or it is different from each one of us. So when the World Health Organization says we can work productively and fruitfully and make contributions to our community, in order to work productively, we need to have a balance that makes sense for us. And that's key. And when there's so many uncertain parts of our days and futures, how is it that we can be productive when we're not even sure what tomorrow will bring? So this is the impact on our own mental health right here, because it's ever changing. And so it might say, when I feel most in balance and I feel most supported, it might look like this. And sometimes going through this practice is actually a good way to help realize some of this work. For a lot of us, we might not have done this work in the past. And so this is a great way to say, let me find out what I need in a day to help so that I can be more productive. And, when you have some relief, I would say, like even in my own work, when my employer comes forward and says, we're going to be working remotely, and we recognize that some of you will have a different type of a work day. Just even giving that information and saying we trust you and we know that you're going to get this done is enough to empower the individual to find the balance. So if your balance includes having young kids or having folks who you're taking care of, etc., and that takes up a bulk of your day, how might you be able to change your work pattern so that you can feel productive and find balances? So it's also a good practice to go through some of this so that we can find out what we need for our own baseline. Now, so what is also important here is we're going to be talking about well-being as well, which is really key. So often we only focus on what's wrong or what's most difficult. Why is this happening? Why is it hard now? It never has been before, that type of a thing. And we need to explore well-being as much as we need to explore mental health. There are 4 quadrants that we're going to talk about around mental wellness and what makes up a healthy, or what I like to say, a healthier community as a result. So when we have healthier communities, it allows people to thrive in each area of the quadrant. Okay, so if you think of a community, and we'll talk a little bit about communities, because communities are not just where we live, the street that I live on, or the neighborhood that I'm in, but it also involves all parts of our lives. So we build community everywhere. We have, I have my work community, for example, my union community, my school community. Other folks may have different types. And maybe a sports community, a temple, a church, etc. All these different types of places and spaces. And so this chart here that you're looking at actually looks at the very concrete terms for each aspect of mental well-being. So for example, I'll go through the 4. In the top left, economic well-being. So economic as well-being is when economically communities have enough resources and money, and their people may be afforded a living wage. They would have access to a home, clothing, to food, for example. Politically, in a political well-being is when communities are equitable. We have strong, supportive leadership who prioritizes safety and fairness for all. Everyone has the right to speak and to be heard. Social well-being is when everyone has the right to belong and the ability to care for one another. So there is an understanding of emotions, connection to others, coping mechanisms are accessible and they're supported. There's self-worth and ability to trust, and choice in how we relate to others. And the fourth is mental and emotional well-being, is when we're afforded the right to feel good or to be happy. There are supports for happiness and connection, and all members are valued. So essentially, this is an ideal or healthier or healthy community, and it outlines a baseline for a place that allows people to prosper. And when one of these quadrants is lacking or limiting, it impacts our well-being, and it impacts us each differently. So not only the communities we live in, again, but these communities that we create in our union, in each component, and as a prairie region. And so the importance then is that interconnectedness. And so well-being, as you can imagine, if one part of this of your well-being was struggling, or you had less access or major impact in one of these, it would affect each one of those. And so essentially that's what we're trying to do here, is say, how do we build healthier communities and stronger locals as a result? One thing I will note too, just at the bottom, so whenever I'm using some of these concepts, a lot of it is built in through a number of different workshops, but then also as a United Way Winnipeg staff, as a labor director, we've also teach the labor community advocate training. And so some pieces of this I've made reference to. So if it's of interest to you, you may have the opportunity to explore further education. And so the link is at the bottom to connect you there, so that you can look to expand education in that area. So social determinants of health. So we just talked about balance and well-being and the different quadrants. Now, what are some of the factors that might prevent these four quadrants of well-being? So what are the things that exist that may impact those four areas for us? These are called the social determinants of health. So you might have heard about the social determinants of health before, but if you have not, these are the very factors that can impact and prevent access to our human rights. These are the things that each one of them is different. As I was saying before, we're individuals and everything affects us each differently. But we all have human rights. And so these are some of the pieces that may prevent full access and full support. And full protection of our rights. So fair and equitable access to health and social services. So it's not only to meet our basic needs, but to ensure we have our needs met and that we have the right to be supported in our communities. So as you're looking through this list, I'll get you to start thinking about this as we move forward into talking about mental health and access to programming. So our federal and provincial health systems and governments, all of them recognize that all these factors affect a person's health. So being and becoming healthy is a much bigger and more complex problem or reality than what an individual does or doesn't do. So we're a part of a bigger piece. Our health is not just based on one part of us. It's a combination of all these things. So our communities and governments at all levels are involved in making decisions around systemic factors that can improve someone's health or not. Okay, and that's what would be the pieces that prevent it. So I'd like you to keep this idea and discussion in mind as we talk about mental health over the next couple of slides. So as we move forward, we'll talk about the individual a lot, or the member or ourselves, for example, who are experiencing the impacts. But the individual always exists within a larger context, whether that's good or bad. So as labor leaders, staff members, ourselves, we can play a role in assisting the individual. It's what we do really well. We work to protect workers. We build on the past. We look to protect workers now, and we're always working to protect in the future. But that individual can also play a role in affecting their context, so that the greater piece, the greater world. And we'll talk more about this as we go through the webinar. So if we can help affect one person and provide them the tools to help understand some of these social determinants, they in turn can make a difference in a bigger context by addressing some of these very basic needs. So we're going to try a video. We had some struggles before, and I'm hopeful that we can get it going. If for some reason we're not able to, we'll get to that point here, and then we can share the link. But let's give it a try.
And cross our fingers.
Yeah, fingers are crossed. Just let me know if you hear some sound.
Oh, sorry, Gina, I'm not getting any audio, so I'm assuming
Okay.
nobody else is.
Yeah, we can't, I don't know what the barrier is there, but the sound hasn't, I can hear it perfectly fine in my microphone, or my headset. So let's just leave it there. That's fine. This is a great video featuring a PSAC member, which is nice. But it's developed by the Canadian Labour Congress, CLC. And so I put the link at the bottom. And I'd encourage you to it's 4.5 minutes. Take a watch afterwards if you're able to. It's in both French and English. And I'll just give you a synopsis. I'll just go through it a bit so that I can help pull out some of those pieces from the video. It's also available on YouTube. It's plugged in right there, like you can see, and then just click on that link afterwards and it should be no problem. So I'll tell you a little bit about the film. Mental health is an important topic of discussion and of that is a structure and a framework that the CLC is working to advance. And so you might have been a part of some of the CLC national lobby days around mental health at work. There's different pieces that they've taken on for those lobby days, but it's a great way to help bring that conversation forward. So mental health is important to the CLC, not only to them too, but as affiliates, our unions, the workers, etc., because it affects not only our members and ourselves, but also our families and the communities that we're a part of. And people come to work, and we want them to come to work in a whole way. We want them to bring their whole selves, and so we don't. When a member has to leave a certain part of them at the door and not talk about certain aspects of their lives, it impacts their work. And so most people know someone with a mental health, whether that be an illness, they're living with different challenges, etc. So better mental health care, an end to discrimination against people with mental illness, and equitable work opportunities are human rights issues, and that's what this gets at. Some mental illnesses also affect equity-seeking groups disproportionately. And I've put some links into the end to help bring you together to a point where we can start looking at some of the different types of resources that exist for some of our equity members. So mental health plays an important role in the fight for justice, no matter what. When it comes to the workplace, mental illness accounts for about 1/3 of all disability claims. So fighting for better mental health can help keep workers in their jobs. It can help prevent mental illness from occurring in the first place by challenging some of these systemic issues in the workplace and in broader society. So it in turn creates stronger environments when we do deal with these realities. So there's been a lot of work in recent years to get people talking about mental illness, and that's a good thing, no matter what. But part of what's missing in that conversation, and part of what unions can bring, is a broader social collective context. How we can bring workers and workplaces together and build these stronger communities. And that's a great part about being a part of our labor movement, is the impact and the change that we can create through our education and collaboration. Okay, sorry, this started without Sorry about that. The video started again. So I'd like to talk a little bit further about how mental health and well-being and how it affects workers and workplaces, and that we need to challenge ourselves in some of the ways to recognize that all members have needs and all members have different needs. And especially during a crisis, having different needs, we may be experiencing things we've never experienced in our lives. And so to recognize that we all have basic needs, like eating and sleeping, for example, the need to feel safe, to feel included, like we belong to a part of a community or any type of community, but we also have the need to grow, to feel like we've accomplished something, as well as the desire to learn new things and gain new skills to reach our full potential in life. We might have interests in that area about advancing education, etc. But as we know, individuals exist within this context. They're not just single issues and realities. So I mentioned this before when we were speaking about the social determinants of health. There's more to us than just one piece of it. So if you don't have food, for example, or a place to live, you're probably not worrying about law and order or the daily updates that we're receiving around the pandemic, and maybe not even about affection or personal growth. And mental health can then become a luxury, right? And so if we don't have our basic needs met and we're feeling pressures and different experiences, and it's affecting us in all kinds of different ways, that might be the last of our concern. So in our own social context, this can lead to a question of where particular symptoms point to an illness rather than an unmet need, which is really important, and that's what you're looking at here. So you'll note that most often mental illness is presented as an individual problem, and that people with mental illness just need to learn to cope better. We hear this all the time. For example, everything will be fine. If you don't worry about it or you don't watch the news, everything will be fine. When in reality, during a crisis, members may turn to each other, to others, and quite often. So a lot of times, though, they may be faced with negative or unfavorable attitudes towards groups of people, and in turn, it might make an individual feel like that they're not at their quote-unquote normal place or their balanced place as a result. And others might not, might have shared experiences, but they might not be experiencing the same type of reality, and it may be impacting them in different ways. And so it's important to diversify and understand what might be happening and what need we might need met, and one person might not meet that need. And so a lot of times people will be told to, just go talk to someone and they can figure it out and keep going. But if they need to meet another basic need, it's not always coming from that same person. And that's stigma. So it builds stigma. Stigma is a negative or unfavorable attitude towards a group of people. So it's a thought pattern, and it fuels discrimination, and it's oppressive. And so we'll talk a little bit about stigma and discrimination here, because it's no matter what, we talk about discrimination quite openly in the labor movement. We have great provisions and language. The labor movement has done the work to understand and legislate and protect workers and communities around harassment and discrimination, bullying, etc. But stigma is one of those things that can be hard to talk about. So I wanted to bring that up here. So what is stigma? Stigma can happen absolutely anywhere. So with friends and family who might not understand what the person is going through, and they may be reluctant to tell others about their diagnosis, for example. And also I will note that there's also an expectation that someone has to disclose that they have any symptoms of an illness as well, to justify. And so that's stigmatizing as well. Stigma may also present itself at work, where colleagues can be passed over for promotion, and members, or socially isolated from workers. So there's lots of impacts in the workplace as well. In the media, we see it quite readily, where mental illness is often sensationalized, and people with mental illnesses are portrayed as very often as violent, amusing, pathetic, as drug users, etc. And they create these characters. Many people with mental illness say that stigma associated with their disorder is often as hard, if not harder, to deal with than the symptoms of their illness. So they often feel judged or embarrassed, shamed, and hated by others in some cases. So why does this stigma exist? Mental illnesses are invisible. It's not something you see. They can manifest themselves through behavior. A common misconception is one that everyone is able to choose and therefore control how they behave, think, or feel. People fear that what they don't understand as well. It is only recently that we know that mental illness is a biological illness, just like diabetes, cancer, heart disease, etc. Stigmatizing language is used all the time. People using the word nuts, crazy, mental, it's built into people's language. People use the word psycho, junkie, all these really heavy words that I don't like saying. They're built in, and young people are socialized, and it's just a part of the descriptors that they use. And this is really prevalent in our vocabulary, and it serves to reinforce these stereotypes. So what are some of the effects of stigma and discrimination during a crisis like we're experiencing right now? Stigma limits a person's ability to potentially get and keep a job. It's a very difficult time, even during, if someone has experienced layoff, if it's a permanent layoff, what do they do? Is it going to be easier for them to get another job or apply for benefits, etc.? There's all these questions, but during this time, that could be one of the hardest things. During this time also, someone might need to advocate to keep their job around pay continuance. They may be worried about pay continuance or have impacts around opting in for self-isolation. So a lot of the language that we're learning is that someone we have protections around it for sure, but someone may need to self-isolate, and if that may mean that they have a threat of losing their job or that they may have a permanent layoff, and we're complex beings, they've got all kinds of different needs, there's things happening in their life, they're putting all the pressure on an individual then to disclose the self-isolation. So a lot of heavy things that are added on during a time of crisis. Also finding a safe place to live or advocate for rent or mortgage deferrals. So a lot of pressure is put on an individual person to then navigate all the systems. I've known some of my colleagues have been on the phone for 4 hours a day, 24 hours in the week, trying to find out about certain types of benefits, etc. And so when we put this all on an individual, it's solidarity. Like, we're truly stronger together when we can help work through some of this together, so that it's not all just pressure pointed right onto one individual. And so another piece too is during this time is around advocating for healthcare. So a lot of times we're moving to phone appointments. At what point do I decide, do my medications need to change? And do I have how much time do I have on the phone to speak with a service provider? And if you've got all kinds of things happening during that day, is it even possible to meet with that service provider? So as you can tell, all these different pieces. Also too, during this time, there's a lot of reliance on an individual to maintain a positive attitude, to reach out and build community. And when that's not something you practice normally, it can lead to steep isolation. So how do I find community, and what do I do to build on these relationships? And what if these relationships aren't safe for me during my home? And we'll come to some of that at the end as well with resources. So as you can tell, there's a lot of pressures. There's all kinds of provisions as well. We have great protective language, but there's also those pieces like bill deferrals and all these different things coming in left, right, and center about, you know, all you need to do is X, Y, and Z to advocate for yourself, but that can be one of the most difficult things. And how do we know when a member is having a hard time? We need to understand and have the conversation, because it's the only way to know. So here, referenced on the bottom, you'll see we've got a chart around a mental health continuum model. Now, I do want to talk about this, of course, but it's for sure not a tool that we would ever say this is to diagnose anyone. That's not the intent at all. So it's not for a diagnosis. It's to help understand that things change in a person's life. You may feel a certain way today and might not feel the same way tomorrow. And so everyone moves on this mental health continuum. And it's not, the intent of it is not to peg someone to diagnose or to give the tool to someone when they are struggling. This is for us to use to look at, to say, how might I be able to gauge my referrals? So if someone's in a very difficult place, I might be able to look at this chart and say, you know what, I can start a conversation about this. And you know, do you feel comfortable? Do you have a support system? And you can start asking these questions that we'll talk about a little later in the webinar, but just as a cautious note, I just wanted to make that clear. You do have it in the handouts as well, so that is something that you can help reference. So it shows us how mental health changes in our life, sometimes on a daily basis, and I would say lately it could happen, you know, by the hour. It could shift and change. You might be watching the news and it may cause a reaction, and it may cause a trigger point too, trauma related triggers, etc. There's all kinds of different ways that can change. And so sometimes over these years and over these days, depending on what's happening in our life, it's a continuum. It's quite natural to move back and forth on it depending on what's going on in our lives and all the other factors. I won't spend too much more time on this, but it is a good resource to have. But to point out, starting in the green there, it shows you right from a healthy place, or that balanced place. I would say a healthier place for an individual might be when those 4 quadrants feel in balance, you have what you need. So that's looking at that all the way to one side in the red where we may experience a crisis. So right from everything in between. So it shows you which parts of the continuum can generally be managed by an individual with some supports, and what might be more serious and will likely need some more professional help, for example. And so these may be useful tools for yourself, but then also as in your components, if you're an executive, etc. But just to remember that it's not something that we gauge where people are at, but just to recognize the different types of referrals that you can make to just help the members. That's really what it's about. And that's where we'll shift into, is starting to talk about resources. So how do we help membership and how do we help each other and build that? And so over the next couple of slides, you'll see at the bottom too, I've referenced, this one is referencing a national tool. So it's called When the Paycheck Stops. So you might have you might remember seeing that. United Ways also worked with the CLC. It's a partnership, and they put together, each province will put together a When the Paycheck Stops, like a regional pamphlet that's really strike support driven. So if there's if you're on pending strike, etc., or you are on strike, then we have these resources for you to help build connection point around a couple of basic needs. Now, during this time, we also are dealing with When the Paycheck Stops, but on a national level. And so the reference is here, but I will note that because it's national, not each one of the provinces, of course, will have the same access. And so it is still an important resource to check out, but it's very different from Manitoba to Saskatchewan to Alberta than it would be to BC, right? And so that's just something to note. But this national resource is a great tool. It talks about work stoppage, work shortage to pay. It addresses pay continuance, job security, or during that time. It can be helpful during when job security is unknown. Things are changing. You don't know how long you're going to be working from home, or how long you'll be deemed essential service, etc. So without having gone through a pandemic before, workers, governments, employers are all left in a state of reaction. And so that's why you see changing information. Everything from a type of mask today might not have been provisioned last week. And so this information changes. So the best thing about the union and your union here is that you have the opportunity to negotiate and create space and place for negotiation to happen so that we can help ensure that these provisions for workers are in place. So it's a great time for us to be able to come together. And like Marianne was saying, like, what do we need to learn about? What else is coming up for you? Like, let's look at that and address it. But no matter what the impact, the labor movement is the place that doesn't have to be as reactive. They can take that reactive piece and also build in and ensure that we have a baseline for protections. So essentially, you're taking those 4 quadrants and saying, for the labor movement, we need to have a balance as well. We need to have a balance, and we need letters of understanding or memorandums of understanding. We can help negotiate that or have them signed in so that our workplaces and workers have protections. And these are the important tools that a union can use during a time of crisis. Because no matter what, stress and anxiety may build for those who have never experienced disorders or challenges or illnesses before as well. And so this might be a first time where someone has, moves on that scale right to a place of crisis because of just so many unknowns. And so the importance of self-care here becomes a tool that stewards and union advocates can use to help members through this time and to help balance the weight and severity of this unknown territory together. So it can be compounding work-related stress, but these are the ways where we can say we have a pulse on what's happening in a workplace. And we share that information so we can help support and build that group. And maybe it becomes some online check-ins that you have with your membership. Might it be weekly? You never know. You can really be creative in the ways that you do this, but you have your United Ways there with labor programs as well to help you do some of this work. There's also in each province and nationally, we have a COVID-19 response fund. So United Way in each province will have a fund, and some of the funds, for example, I come from a composite local with almost 32 different workplaces. One of them experienced an entire staff cut and layoff, permanent layoff. And then they hired back a tiny slice of workers, but they were actually able to access some of those United Way funds to help alleviate some of those layoffs and actually do a recall to have some of the workers there. And so some of these funds can actually be used for job security, because that's the goal, is how do we keep these agencies for our communities open so that we can help each other and that we might need to access as well. So unemployment support or other pieces, connections to social supports through 211 that I'll talk about a little bit more. Some of the Canadian emergency benefits, EI, all of those important components of supporting the membership are here, all in one resource. So you can check that out. And just to remember, it is national in scope. So if you're wondering if each one of those pieces that they talk about is relevant in your community, then you can get in touch with your labor director. So you might recognize this pamphlet. Marianne, you might even be in that pamphlet. It's a Manitoba one, so you'll recognize that flag. But what to do when the paycheck stops, and that's the local resource I was talking about. So this is one, and I put the link there so you can check out the website and download a version really easily. But locally, each one of our provinces has this version, and it may look a little bit different, and that's okay. It still has great information, but it talks about what to do when the paycheck stops, but it's a useful resource for times when there may be upcoming or immediate interruptions of any kind, or fears of stoppage, fears around pay continuance. And it's important to have support around advocacy and community connections, because so often we have so many community resources in each one of our own cities or communities, etc. But how do you even know where to go and how to find them? And especially when you have so much going on, referrals are incredible. It's a great way to share that, but where can you go when you need some of these basic needs met and they're acute? So a resource like this is exactly why it was created. So really, I'll just summarize it into 3 points. So during this reality for our members right now, some of the things that members could consider are communication, so that's key. So how do we make a plan to get through it? It may be a personal piece. I might be making changes to the way that I live or the way that I purchase, or I might be making changes. I need to communicate more with my union. I want to know from my union what's happening. There's a lot of trust and solidarity built there, and strength in building that stronger relationship with our union. And so if you can help bring some of that information together for members, they can come and use the local and the union in a way of as a support tool as well to help understand some of this. So just as an example, in my workplace, we have one person on staff that will listen to all of the updates for an entire week, and then she writes us a point form document so that we can read through and just have snippets of information to help us understand where some of the changes are happening. That's a great tool to have, something like that, especially how it relates to your members and the work that you're doing. Another is evaluating, budgeting. So might I need to plan for a change, and where do I find a budget tool? If you can come into this one place, it connects you to a point where these are the agencies you can work with. How do I manage payments, necessities? Are there changes to that? How do I apply for these different pieces? And then also the last one is ACT. So there's so many different things happening right now with different benefit provisions, employment insurance or provincial benefits available, government-specific supports. They might be rolling out nationally, but as you know, in some of our prairie provinces, if you're from Manitoba, you'll realize quickly that those haven't happened locally. So what do we do in that case? When some of our brother, sister, and friends across the union are receiving different benefits than we are, but we're all as part of the same union. So how do we help understand that? And that's where the union can rise above and really look to create memorandums and letters of understanding so that we can help create a solid baseline for our members, no matter what province we're in, because each one of the provincial governments will change, but our union doesn't change. So that's the strength of the union. And so here we have, I'll talk a little bit about 211 as a tool. So you might have heard about it before. We talked about it earlier. Some people have said, oh, I've seen those cards, but I didn't know what it really did. This was a campaign for 211 Manitoba, and I'll show you the other provinces as well, but this is one that on National 211 Day, February 11th, which was 211, we had a campaign that rolled out to over 600 and some workplaces and all through our social media, and we talked about the ways that workers and people need access to community supports, social supports. And so 211 is a great tool for stewards, for member advocates, for frontline workers, etc. Because often when you're struggling And let's say you're having a difficult time with food security, you don't go to the workplace and say, if someone says, how are you doing? It's probably not something you're going to disclose, that you're not sure how you're going to get groceries. But 211 operates as a platform that can help connect you to community public services. I will say that community supports and public services just by doing a search. And so it's location based, so it's going to use your phone location. So if I was searching here in Winnipeg, it would pull Winnipeg resources directly to me and tell me how far I am to each one of those. Now, if I was traveling, say you were having your convention in Calgary, and I came to join you to do a presentation and I needed support, I got a phone call at the hotel and something happened from home, I could type it in and it's actually going to search support services around me in Calgary. So whatever your location is. So 211 is a great tool. It's and I'll show you each province is a little bit different in how you access it, but it's essentially for frontline members. It provides them with the tools to build support and access to community health and social service sector. And it doesn't pull from privatized services, it's public service driven. And so that's key because it directs us to the services where we may be accessing unionized services, etc. Our roles as leaders now, as whether we're a member, we're on a committee, we're an executive leader, etc. Our role as leaders are to help share the tools. So this is a 24/7 tool that you can search in the middle of the night if you need to. But it helps you navigate a complex system, right? We talked about individual needs. If I need an individual need met, I might be able to search it here. But it doesn't mean I just need food. There might be other things happening. And so the nice thing about this is it helps pull together a social support for you. So if you're looking for one topic, it also helps build this complex system. And it can be hard to figure out community health and community services. And it can be very complicated. And often it's a barrier and it can make it really challenging. So in some cases, you'll have families using this for finding rent support or job skills and training and that sort of thing. It's essentially a front door access service to the community. So what does it look like across Canada? So it does look different. There's obviously some parts of Canada that don't have that same access. They would be covered under 211.ca, which is a national platform. So if you were traveling to a region that didn't have its own system, like I'm going to show you, you could also type in 211.ca. So if you're traveling for union business, you can type in 211.ca and it's going to pull location-based resources to you or for you. So it's fairly active across most of Canada, and it navigates human services from all three coasts. So Manitoba right now is the only province that you'll see out of these 8 that offers web only. And it's not because we don't want to, but it's that it's the only volunteer run program. So not receiving provincial funding. So in the coming weeks, you'll see more about that case for building it because it is an incredible resource tool, but we're not quite there yet, but it is very important to recognize. And you'll see across in the Prairie region, Alberta has a live answering, so 24/7, it's actually a call center basis that you can text or chat. It's 150 languages available. There's online resources. It's province-wide, just launched province-wide, and so great access and well-funded. Saskatchewan, same thing. You're looking at 24 hours on the phone, etc. Now, the nice thing about having a call center is that you can type or phone in and they can give you a live update. So versus a computer program where you can say, yes, we update every month, but as you know, COVID-related crisis times during this pandemic, services are changing daily. I went to a post office yesterday. It was said it was open till 8, and I got there and they had closed at 6. So everything's different depending on the day. And so that's something live, is that if you need a call, you can call during that time and they'll be able to give you that information. So one last piece to note about that as well is that it's a great tool for if you're having your convention or your conference, you're having a committee meeting or an executive board meeting, whatever the case, that when people are traveling to a city that they haven't been, that's a tool for them to have a social support and community support while they're there. So what does it look like in the prairies? So you'll see the 3 pictures. Up in the top right is Manitoba. And so the Manitoba platform opens up and we operate by tiles. So you can see different images, etc. Of course, during this crisis response, all 3 of the platforms, and all of them across Canada actually, will have very specific COVID-19 related messaging. And in Manitoba, because we operate just online, you can click each one of those and get updates, but then also who are the emergency resources. So you can come in there and click on an image and say, you know, I'll use a stat from Manitoba. Our top 3 searches in Manitoba are mental health and addictions, food and clothing, and employment and training. And just in the last 2 weeks, that's shifted to the top priority of searching being food and clothing. So people looking for food security support. And so it can help understanding this platform and being involved in it, especially as PSAC, being able to have a seat at these tables can also build in, it's a knowledge base. It also tells me as a labor director that people are struggling with food security. And so just this past Monday, the Winnipeg Labor Council, our labor program, and the CLC rep supported, we launched a labor food drive. So just finding ways that you can help respond to the needs. And so it's grown 50% just in the last week and a bit in access. So each one of the platforms is great, and you can see quite easily what they look like there, and they're easy to search and they'll work on your mobile phone, etc. Some of the materials and resources you have full access to through your labor directors and your labor program staff through the United Ways across each province. So on the left, there's a big poster. You can get small business cards like the ones down the middle, or those sort of like cell phone looking cards, a handbill. And if you want to look at ordering bulk materials or getting it out or asking for the PDFs, whatever it is that can help build, it's a great tool to use to send to members and say, if something comes up and you need support, no matter what time of day, here's the resource for you. So just know that those are available to each one of you at any time. A lot of them are available online, but you have my contact info. I can help connect you in your own region too if you're looking. And now just to keep an eye on time, we're getting close to the end here, and I've got a couple more pieces to talk about just around support and some of the direct action we can take. Again, the links are here so that if you do want further information about some of these, they're all referenced, and there's a reference page at the end. But some of the ways that just even in like, where do you start? Most people will say, where do I start? How do I support members? How do I know what they're going through? Just even knowing the facts like we're talking about today. And then also taking it in and saying, I'm going to be aware of my attitudes, my own behavior. What kind of language am I using? Am I talking about mental health and well-being? Maybe that is the door opener for people to know that I am someone they can talk to. Choosing our words carefully, educating others, just like we're doing, sourcing out different types of information and needs that you need, like let's build the community. That's why we're here. That's one of the ways that we can focus on the positive and help move some of this really heavy information and daunting times into support. So what are the tools that we can use? And unions become the leaders in that sense. So we become that community contact to build stronger communities. And we include everyone, and that's key. And Everyone has different coping strategies, but if we can provide a general understanding, every person makes up an important part of the community, and they can help inform the work of our union. So it's just really up to us to make sure that that happens. So social supports, that's really key. We all need to feel that sense of belonging, and it's one of the things that we learn quite young as through adolescent development, etc. But we all need to feel like we belong and that others care about our well-being. This is what social support is, truly, the belonging and care we receive from other people. So when we have these types of people in our lives to help us with that, it becomes our social support network. I've worked in the social service sector so long. So social support network. So these networks can include family members, friends, union colleagues, neighbors, community and social health professionals, etc. Those could be nurses, counselors, peer support workers, etc. All those types of folks. People need people. And often we underestimate how much we might benefit from this support. You know, when you're on, like, it's even hard now. You can see me, but I can't see anyone, right? So I'm sure if my neighbor looked across, she'd be wondering who I'm talking to, but you build that sense of social support. So you might find ways reaching out, you know, every Monday you get a friend group together and just meet online and have each other to talk to. If you're not finding that network and you don't have it, is how do we find it in other places? So how do we build that? And the union is a place to do that. It's the foundation of what we do, solidarity and understanding how we connect, etc. We can create these spaces. So everyone may need different types of support, and that's true. So social support networks, you may have multiple social support networks to help meet the needs. Your own needs, emotional support, knowledgeable advice, new perspectives, practical help. These are all different pieces. You may have one reality or one challenge that you're working through, and you might need emotional support from some people, and you might find knowledgeable advice from a colleague or a new perspective that someone shared after they watched the webinar tonight. And you might also access practical help, which is, I need someone who can help me during this time. A childcare provider didn't call or called in sick. Who do I have in my life? And so this is a time right now that we can help our members understand what a social network is, a social support network, and who might be in their social support network. And when they do find the lack, or they might have missing pieces, like those 4 quadrants, how can we help build that? How do we create community? And so sometimes even some of these small tasks can feel really overwhelming for folks. So really practical help and connections can really make the difference. Just a couple of last points on how do we build these. You might not have ever needed a social support network like you do now during the pandemic. So knowing how to build these networks for yourself and for your colleagues and for our fellow members is key to building a stronger community. Social support networks usually change over time, and that's totally fair. Life situations change. People can change, and some people may lose an important person in their lives and are looking for that connection point out elsewhere. Sometimes a person has a lot of people in their social support network, or it seems like they do, but not all those people can provide the support that's needed. So you may need different types, and others may find that they simply need more support than they currently receive. And then so what do we do? So in any situation, you can take action to build a social network. So how do we do this? We can connect through our networks. We can ask for help. We can remember reaching out takes strength, and we can model that as well, even by asking the question. Like when Marianne was saying, we want to know what else. You can't connect in person to person. So, tell us, what's of interest to you and what do you need right now. So we can take care of important relationships that we have and some that we need to build on as well. So you can't always ask for help. You can't only ask for help, I should say, but you can offer support to others in your network. And I'm seeing a lot of that build online where people are creating groups of communities that are coming together and saying, let's help each other. And it's a real foundation, actually comes out of the labor movement of mutual aid societies in those early days of organizing one big union model. But mutual aid is, and you've seen it come together through community groups or neighborhood pages, etc. So those are great things to get connected to. What's important too is to be clear what kind of help that you need, what kind of resources or supports. You might feel like I just miss talking to people on Friday evenings or whatever the case, and reach out. If you put work into a relationship and you're not seeing any kinds of improvements, it might be time to find build your network up. It doesn't always have to just rely on your one that you're used to. So just the last couple things is just about starting a conversation. In your handouts too, in the ongoing one, it's called Union Strategies for Mental Health. There's a handout called the five-step handout. It's basically having a conversation in 5 steps, and it helps outline how do we start that. If you've never talked to someone about mental health and well-being before, how do you start it? And it can be difficult to get that started or to understand. You don't have to have all the answers. It's really just about how do I ask the questions so that people know that we have the resources and supports in our labor movement and in our union, and I can help connect you to that. And that's great as well. So feel free to check that out. Some key pieces around that are just around privacy and confidentiality, your relationship with the member. So, do you have trust there? Is there someone better who might be able to help you with that conversation? If it's about a union executive member, who might we go to? What if the member doesn't respond well, or you have a difficult time with it? What do we do? So you can use that tool that I provided there, the 5-step process, and it's based off of a CMHA tool, actually, about starting conversations. And that is a great resource to help you along the way. Mindfulness is another piece. We've talked about well-being, but also mindfulness can be practiced in many, many different ways. It's something I love this photo because it's something that people sort of file away often, right? We don't always do those things until we need to do those types of things. So it's not always just about a formal group or a class to check in with yourself, but there's no right or wrong in this category. So you experience what you experience. But here's a couple of quick mindfulness techniques that you can practice anywhere. Just a couple things you can do to help refresh your day, to help find a balance again, to help feel connected. Eating a meal without distractions or devices, just feeling present, being able to understand that a lot of heavy things are happening, but just find some time to spend with yourself, and whether that's reading a book or playing a game or doing a puzzle, those kinds of things. Going for a walk or doing something within your own ability that you're able to do to just change the scenario. If you're working remotely and you're working from home, I've been working in my dining room. I ended up going into the office and bringing a more comfortable chair home, so I didn't have to sit on a 1950s, my grandma's 1950s chairs, right? So just something that you can do to help feel better about what you're doing, and to make it easier, because we don't always have all the ergonomics we need as well. Talking with a friend face to face, without distractions, and using some technology. There's all kinds out there right now that people are sharing. Someone you can talk to without judgments or expectations, and notice how you feel in those things and stay connected. Check in with yourself. Give yourself ideas of what you'd like to do. There might be a project in that you'd like to take on, or you just have a nap in the day. Whatever it is that you can find, mindfulness is different for each one of us, and those are things that we can do for ourselves every day. But we can also mentor that and share some of the ways that we're doing it when folks are struggling. And just the last two slides, what's our union doing? So they, of course, are being informed. You're moving ahead so quickly and so well with education sessions and allowing opportunities to have conversation. So they're becoming informed, listening. We're talking about different referrals and community connections and liaison. We're talking about follow-up. So if you ever touch base with someone, make sure to follow up. That follow-up piece is really key. Diversify the way that you communicate with your members. So look at the different ways that you can, maybe it's sending a blast out around the 211 for your province through the Facebook page or through a member news list, etc. Just letting people know that you care about them and that their well-being is important to you during this time. And these are the ways that we can help build stronger union movements as well, because when members feel connected to their unions, really unions have created the social service sector, right? And so it's us bringing us back to our roots and making those connections with members. These are some of the things you can do. Stay connected, create routine. And the importance of staying active in the environment, building the community, summarizing government updates, which we've talked about. You can do all these kinds of things. And so what I've included in the, for a last, I'll just go, are just two new slides. One around domestic violence, sexual assault in COVID-19. And so sometimes when people are surviving violence in their relationships and families, these are the places that with increased isolation, danger, may be in more danger, sorry. Survivors also have specific needs around safety, health, and confidentiality. And so we can connect through resources and tools. 211 is a great thing to have on hand as well, but also to make it known that they can reach out at any point as well. But also understanding what services are in your community is key. So you may be sharing how folks can make safety plans and self-care plans, where they might find crisis lines and resources, advocacy, different types of remote tech resources that they might be able to access. And so I've included 3 of the associations of women centers for the most part, and they'll talk about all the services available in each community for the provinces. So that'll be something that is key. Another piece too is just around what's some useful information for our equity members around COVID-19, around travel and immigration, for example, provincial supports and regulations. What do you do? How do you apply for some of these protections when you don't have a social insurance number yet, or if you are not a permanent resident? And so I've included some resources here, and then one specific to 2S LGBTQ plus immigrants and refugees as well. So added barriers and determinants of health as well. So important to recognize those in all 3. And then there's a new publication that was out just this week. Actually, it was just 2 days ago, around the impact. It's an impact report on COVID-19 and the 2S LGBTQ community. So that might be something of value to take a look at, just to get a sense of what are the impacts and why are equity members disproportionately affected. I also put up some crisis lines and connections, so you'll have that right in the slideshow as well. And then in each province, and give you a sense of each one of those links has just an unbelievable number of resources. So, and then the last slide is just references. So where can I go for some of this information? What might you have seen in some of the webinar? Where are some places where there's some consolidated information, like through some of our Canadian Labour Congress, United Way, etc. groups that are actually pulling some of that information together for us. And that brings us to the end.